Hello, everybody, and welcome once again to Functional Medicine with Dr. Howard Robbins. That's me. Uh, our show is dedicated to giving you safe and effective ways of treating just about every disease and condition that's treatable and certainly improvable. Uh, Today's show is going to be on one of the worst infections psychologically, socially, emotionally, and even spiritually that a person can get, and that is herpes simplex virus, HSV-1 and 2. Simply, everybody calls it herpes, even though there's many different herpes viruses that have various harmful effects on the body. But the herpes simplex, the cold sores that you get in your mouth, the genital sores that you can get, and actually you can get it anywhere on your body. You can get it on your toes, your fingers, your head. I mean, we're going to talk about it all. And then we're going to tell you how you can actually cure it, get rid of it, and get rid of it permanently, completely, once and for all. So one of the things you should do at the beginning of this show is get a pen and paper and be ready to take notes and write it down. If you're listening live, it's a little bit difficult, but once the show gets archived, you'll be able to back up and hear these things again. But definitely write it down because we're going to go over all the details that you really need to know. And when I get phone calls on it, I don't have time to answer the 6 to 10 phone calls a week that I get on herpes. With all the important questions and information that I would want to have if I were you before I go and do anything to try to treat it. And that's why I've done this podcast before, and now I am re-updating it with new and important information. Before I begin the whole thing, let's first thank, and this is important, so write it down, Promolife. Promolife is one of my sponsors, and they make medical ozone generators for home care use for you all. And this is something you may want to do, particularly if you live in an area where you can't get intravenous ozone therapy. And you're going to learn why. So just bear with me, take my advice, write things down. So you can go online and look things up, but what you want to do in the end is call them. And you call them at 888-742-3404. 888-742-3404. And you tell them that you want to get set up. You heard about them here on my show. They'll do something special, a special gift, a percentage off, as a payback for listening. And tell them you heard about it on the show and you want to get set up for home care ozone therapy. And we'll be mentioning what that means a little bit later in the show when we talk about how to treat it. Very important. So write it down, 888-742-3404. And if you want to look at their products on their website, it's promolife.com. 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 Now, write this down. You want to go online to Doctors Biome. I'll repeat this later in the show, but write it down now. DOCTORS, Doctors, BIOME. Sounds like Biome, but it's pronounced Biome. DoctorsBiome.com. And when you go there, you're going to want to order their probiotic beverage, Doctors Biome Gut Health. And for those of you that are having outbreaks, you can get the medical food version of it, Doctors Biome MF, Gut Health MF. The medical food version of it just has more of the bacteria in it, particularly if you're having frequent outbreaks of herpes. You might want to be taking that. It's a delicious probiotic beverage. And you're going to learn why you're not going to want to use the probiotics that you've already been using, the cheap stuff and crap, virtual crap, if you'll excuse me, or don't excuse me, that's out there. Capsule powders and tablets, you're going to learn about why they don't work and why this is a living probiotic beverage. Okay, and why it's so important to boost your immune system to fight herpes and help prevent herpes and get rid of herpes. It's part of the protocols. And you go to doctorsbiome.com, and then you could use the code Howard35, my name, HOWARD 35, and you'll get 10% off the retail price because it's not an inexpensive product. Nothing cheap is good, and nothing good is cheap is an expression for a reason. And you'll see why it's so important later on when we get into it. So first, go to doctorsbiome.com. Then, depending on whether you have frequent outbreaks or not, either order the food supplement version, Doctor's Biome Gut Health, or the medical food version, Doctor's Biome Gut Health MF. And if that's for frequent outbreaks, make sure you put the code Howard35 in. And if you want to get another 10% off, be smart, go on auto ship. This product is now becoming world renowned. It's being sold all over the world. Nutrined in the EU, if you're listening here in the EU, sells it. I think it's nutrined.de or something like that, Nutrined. And so they're selling it throughout the EU and the UK. And you're going to definitely want to be getting this and taking it, once a day. And if you go on auto ship, get another 10% off. So now you got 20% off. That's a big savings. And you get priority shipping here in the USA. It's all free in continental US, free shipping with a 100% money back guarantee. So if for some reason you can't take it, they'll give you your money back and tell you to give what you have left to somebody else who might benefit from it. That's better than a 100% money back guarantee. So having said all that, now let me get into this because there's a lot to tell you. It's not complicated, but there's a lot to tell you, okay? And for those of you that are listening that are going to come in to see me as a patient, this show does not count as a consultation, even though it's a big chunk of my consultation and I have to repeat it for moral, ethical, and legal reasons. But fact is, a consultation is different in that we still have to have one, even though you're ready to go. Most of the herpes patients generally are. But I want to give you what I would want to know to make, before I even make that phone call to come in to see me. So we begin. So herpes is a horrible infection. Generally speaking, it can cause only a variety of serious medical problems. Psychologically, socially, emotionally, and spiritually, it's probably one of the worst infections I've ever seen. I lecture on it. I've lectured on it in several different, in Costa Rica, here in the US, at medical meetings for doctors. In any case, I wondered why it's affected people so severely in that psychological, social, emotional, spiritual way. And what do I mean by that? Doc, I've had people call me, I've had divorces happen over it, engagements end over it. As soon as they find out that a person has herpes, that's it, it's over. Dr. Robbins, this is one I've heard more than once. Dr. Robbins, I come home from work and I'm so depressed. I eat some food, I get into bed, and I literally cry until I go to sleep. I don't go out with friends. I don't answer the phone. I just go to work, come home, and on weekends I just sit in my house and I do absolutely nothing. I feel dirty. Literally, I just feel dirty. It's hard to believe how this has affected people because if you go back to prior to the 1980s, most people didn't really care. If When I was a kid, if you dated a woman and she had a big ugly herpes sore on her lip, you wouldn't kiss her goodnight. But the next week, if the sore was gone, if my tongue could touch her tonsils, I would kiss her and let her, and nobody cared. Nobody thought about it much. So what happened? I went and researched it, and in the early 1980s, various magazines and newspapers started to write about it and make people aware of it and literally just create a horrible stigma around it. In terms of the mild ways it can help problems. Okay. A cold sore doesn't cause any serious issue. If you have it genitally, it may hurt. These things can hurt and they can last for a period of time. We're going to talk all about that, but they don't cause any serious issue. There are serious forms of it. For example, if a woman has it and I'm going to tell you, well, you know what? Before I tell you more serious versions and stuff, let me get back to what I was just saying. I sometimes get off on tangents. You'll forgive me for that. Or don't, but one way or another, it's my show, so you have to forgive me if you want to keep listening. In any case, and by the way, I am not making fun. I am trying to raise spirits. I understand how serious it is to you if you're listening to this and how down and depressed you may be over it. So if I try to make things a little bit lighter, I am not making fun of it or you and your problem and how it's affected you. I'm trying to boost your spirits. So this boosts your immune system, if you understand. But I'm not making jokes. I'm just trying to be a little bit light. So please understand that. I've learned that humor and being light like that can help a lot of people in many ways. So in the early 1980s, they started writing about it and how it's affecting people socially. And by writing about it and people hearing about it that way, it started to affect them socially. To the point where now it's become a social stigma. And we're going to talk about how you get it and how you can prevent getting it and everything else in this show. Well, how is it serious? Well, there's a very, very rare form of it in the sense that it can get into what's called your cerebral spinal fluid. That's the liquid that coats your spinal cord and goes and keeps your brain wet and moist. Okay. And if it can get into the cerebral spinal fluid, it can inflame your brain and cause what's called herpes encephalitis. This is rare, in my opinion. I didn't look up the statistics on it, but I think it's probably as hard to get that as it is to win a lottery. Okay? I've only had one person, but it could kill you. And I only had one woman ever call me up about it. She never came in. I don't know why. I have the answer for it, and she just never decided to come in. Some people are just scared. They're afraid that if you're going to do something, it might make it worse. I do worry. I do understand that very well, that fear that people have. Nothing that we talk about will ever make anybody worse. Okay? It may not help, but it won't make it worse. Then I had one man where it was literally, it came out of his nostril, out of his nose, and it worked its way up, and it had blinded him in his right eye. And now when he came to us, it was coming out of his left nostril, and it was working its way up, and we stopped it about an inch below his left eye. So we saved his vision. because you can get herpes coming out anywhere on your body, on your forehead. It can mosey down to the eyes. We've seen that too. Anywhere on your body, you can get HSV-1 and HSV-2 breakouts, though oral and genital are the most common. If a woman is giving birth and she happens to have HSV-1 or 2, then as the baby exits the birth canal, if there's a flare-up intravaginally, the baby can get it, it can reach the baby's eyes, and it can actually blind the baby. This also is extremely rare, okay? So, but it doesn't mean it doesn't happen, okay? It's happened enough that it's in the literature, but it doesn't generally happen, but I do understand why women who want to have babies want to get rid of this infection, so, as best we possibly can. Now, there's ways to prevent it. First of all, the ultimate way to prevent it is never kiss anybody, never have sex with anybody, never be intimate, never share food or drink with anyone, because you can transmit it orally that way. And you're going to learn how grandma might have given it to you as a baby. She's feeding you oatmeal. She has a little pink bump on her tongue and she doesn't know it. She thinks, when she drank some coffee that morning and her tongue felt, like it was burning, she thought maybe the coffee was a little too hot and she burnt her tongue. But no, it was a little pink bump on her tongue. She didn't, not a full-blown oozy lesion, and she didn't realize when she's feeding you hot oatmeal, ooh, this is too hot. So she blows on it and tastes it a little, and then she gives it to you. Well, she feeds you, and that's when viral shedding, as they call it, can give it to you, okay? So you have to don't share food or drink with anybody. I always tell people who want to drink some water, one of my buddies from my sports bottle or something, I'll let them I'll drink what I want. I'll say, here, you finish the rest. You sure? Yeah, it's for you, because you don't want to take any chances. So that's how I've learned to virtually eliminate those are the ways to virtually eliminate the possibility of getting it. Got to wash your hands, because if you touch things and you put your fingers to your mouth around your face, you certainly can transfer things that way. So frequent washing. These are simple things you can do. But the most important thing is to keep your immune system boosted. And if your immune system is boosted, you won't have a problem to help in the prevention of it. We're going to go to our first commercial break. We'll be right back. Stay with us. Oh, everybody, thanks for staying with us. I know most of you are very nervous and want to hear how to get rid of it, so we're going to talk about that. And unfortunately, there aren't many ways to get rid of it. I know people sell all sorts of products and they make fortunes selling it. Maybe you've tried some of them. It won't work. It may suppress them. That's a good thing. Getting less frequent outbreaks is a wonderful thing. But if you really want to get rid of the virus, there apparently is only one proven way to do it, and we're going to be talking about that. There are ways to suppress it. As I said, keep your immune system boosted. How? Water. You must be well hydrated to have a functional immune system. Drinking no less than 3 or 4 liters of water, that's 3 or 4 quarts of water or healthy liquid every day. Green juices, things like that are valuable and important. You can eat foods that are high in antioxidants, like organic berries, only organic. Please don't eat things that aren't organic. They're loaded with herbicides and pesticides, so you're negating the benefits of the food. Let's see. Lysine. L-lysine is a protein that suppresses outbreaks. Okay. So taking L-lysine, 3, 4, 5,000 milligrams a day can be very beneficial. In divided doses, 6,000 milligrams. They usually come in 1,000 milligram capsules, so you can take 1 or 2, 3 times a day. That can be very helpful. Vitamin C. Now, you need to take vitamin C every 2 hours, and don't buy cheap junk. Listen to my show on vitamin C, but don't buy cheap junk. You have to buy quality vitamin C. Nothing cheap is good, and nothing good is cheap for a reason. That makes it bioabsorbable, bioutilizable, bioavailable, and utilizable. That means your body can absorb it into the blood. Then the cells can pick it up, available, and then use it to do what it needs to do, because it acts as an antioxidant and an immune system booster. I'm giving you the basics. There's many products out there that can boost your immune system. Vitamin A, vitamin D3, vitamin E. There are many different supplements that you could be taking if you can afford to get them and take them. Eating foods, organic foods rich in those things, are also another way to boost your immune system for it. And then, of course, I said it earlier, Doctor's Biome. So why is Doctor's Biome so important? Because if you've killed off by having had an antibiotic even once in your lifetime, or you eat red meat or chicken that isn't organic, kosher, or halal, even farm-raised fish, I don't care if you burn the meat, you're going to get uncooked out doses of antibiotics in addition to having probably taken them orally. This kills all the good bacteria in your gut, but it allows yeast to overgrow in your gut, which is normal to have yeast in your gut, candida in your gut. Well, the problem is, if yeast is overgrowing, the part of your immune system that fights the viral infections, the T cell portion of your immune system, as it's called, has to fight yeast then. And it doesn't have the help of the healthy biome, the healthy, good probiotic bacteria in your gut. Capsule, powder, and tablet probiotics that you probably have been using or plan to take, because they're less expensive, are completely destroyed in the stomach. This has been proven in research by Professors Eliav and Siegel, Doctors Eliav and Siegel in the Weizmann Institute. You can go to the show 60 Minutes in June of 2020 and listen to the show on probiotics, and you'll understand why capsule, powder, and tablet probiotics are virtually worthless. And maybe they act as a placebo, is what Dr. Hibbard from North Carolina University Medical School said. But Doctor's Biome is living in a 100% organic juice, and that's why it's so powerful, because the bacteria are next generation. They're created to survive the stomach over 90%. And they're also smart probiotics. Can't make that up. They didn't go to Harvard or Oxford. They're actually created to stick to the wall of the gut, which will get yeast in balance, repair the gut wall so you can absorb all your nutrients. All these supplements that you're taking to help fight and boost your immune system. So you want to definitely get that. There's not a way around it. All my patients have to use it, and then I get wonderful results. So even if you can't get the therapy we're going to be talking about, you still can do that. Okay? The things that I've just told you. It definitely will help. And Promolife can sell you home care machines that you can do rectal insufflation, which is an ozone enema. And for you ladies, you can do vaginal insufflation if you happen to have intravaginal lesions. You may not feel it. It just may feel like raw or sensitive, particularly if you're being intimate with a man. It could be a herpes outbreak. Make sure, if you're going to, men and women listening to this, if you have to use protection, okay, latex protection, if you're going to be intimate. That's all there is to it. Do not share food or drink with anybody until you know for sure that they're okay. Yet, you can get rid of it permanently, completely, once and for all, and even cure it. And that's what we're going to begin talking about right now. So, How does that work? How does that happen? Well, we have to do one version of intravenous ozone therapy. Why one version? And possibly two now, and that's why I'm bringing up an update in. All right. So, ozone is a gas. It's not a liquid. And when we inject it into your blood, it destroys every virus. And in addition, every fungus, yeast, mold, bacteria, parasite, toxin, and harmful free radical. So listen to my show called Intravenous Ozone Therapy, Everything You Need to Know. Intravenous Ozone Therapy, Everything You Need to Know. It goes over all the different methods and why we use the ones we use, except I did a special show on IOG, Intravenous Ozonated Glycerin. Listen to the shows on intravenous ozonated glycerin because there are studies showing also that it can eliminate viruses. Now, of all the different methods of ozone, proven already is the direct IV method. Direct IV is where we fill a syringe with oxygen and ozone gas at special concentrations, and we push it directly into your vein. In our office, we've done it over 370,000 treatments out of the 420 plus thousand treatments we've done over the last 34 plus years. We're in year 35 right now. No clinic in the world has our clinical experience, no one clinic, and all the doctors probably in North America, at least to the time I'm doing this podcast, probably haven't reached collectively that number of treatments. And we used all the different methods that there are. But this is the only method proven to get rid of viruses. I'm published on how well it worked on Ebola. I'm published on in the African Journal of Infectious Disease, August of 2016. I'm published on how it should work against SARS. And you know what that is. I have to be careful what words I use. But basically speaking, I'm published on that a full week before it was called the serious problem. I have to be careful because this is going to be up on YouTube, which sends computers to search words that he used and eliminate them. But we have amazing results in eliminating it with this this method of intravenous ozone therapy. And I've treated probably now a couple of thousand over the 35 years of patients with HSV-1 and 2 successfully. The key is to stay with it long enough. Now, in all these years, I've only had 2 patients that had an allergic reaction to ozone. By the way, they weren't herpes patients. And so it's about as hard to have an allergic reaction to ozone, and nobody else on our forums or lectures, whenever we get together, has ever mentioned it, that they've ever practically even seen it. I have, because I've done so much, so anything that might happen would. And we just gave some people some Benadryl. It stopped the reaction, and that was the end of it. Wouldn't treat them anymore. Don't take chances. We take Dr. Do No Harm very seriously in our office. In New York State, they don't care if I kill you with a pharmaceutical like Valtrex. But if I hurt one person with ozone, I'm out of business. So, and then I have to go to sleep at night, which is even worse because I can't hurt somebody. I'm not that kind of doctor that can hurt someone and go to sleep easily. So having said all that, there are side effects, and a few you need if you have herpes. Most of them you don't, but you're going to get them. Hair and nails grow healthier and faster. Skin takes on a healthier look because it gets rid of skin problems like HSV-1 and 2. People fall asleep easier, sleep better, need less sleep, more energy all day long, more stamina and endurance. Even for a workout in the gym right afterwards. Here's a biggie. It acts as a painkiller and an anti-inflammatory. So if you're having an outbreak, oh my God, is this helpful? Stimulates natural stem cell activity. I'll be speaking next week from the date of this call. at the American Academy of Stem Cell Therapy in Miami at their big spring meeting. Because of the benefits of ozone, and it has circulation benefits as well. All positive effects, whether you need them or not, and two of them you definitely need if you have herpes. In addition to the killing of the virus and the cleansing, detoxifying, and boosting of your immune system that everybody gets from the therapy. Now, there is no average, typical, or usual number of treatments that it takes to get rid of this infection using that direct IV method. And the other methods of ozone, the blood methods of ozone, the MAH, the hyperbaric high-dose ozone, nicknamed 10-pass, the EBOO, the extracorporeal blood ozonation oxygenation, which is blood dialysis ozone, does not seem to be able to get rid of the virus. It may suppress it, even though it's more expensive ways of getting it. It may suppress the outbreaks, but apparently not able to eliminate the virus permanently, completely, once and for all, or cure it. Don't know why. I'm not a research scientist, so I don't have a laboratory where I can do all this expensive testing and try to figure these things out, but definitely doesn't do that. Now, the therapy takes 2 to 6 minutes. Listen to the show. It goes into more of the details about it. And it's possible to do this therapy as much as twice a day, 6 days a week. Kill, 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 kill. Doesn't give anything a chance to regrow, regenerate, and duplicate. And it's not a guided missile. I can't whisper in its ear, hey, go after HSV-1 today. Leave HSV-2 alone. Doesn't work that way. It has to go after whatever it meets that doesn't belong in your body and kill it. Thus, it cleanses, detoxifies, boosts your immune system because it gets rid of virtually everything that doesn't belong there without hurting you and your healthy cells, tissues, and organs. Can only benefit from it, cannot be harmed by it when done correctly by medically trained healthcare professionals. Medically trained healthcare professionals. And I've trained doctors from all over the world in this method. Many of them choose to use this method. Some of them don't. It's their choice. I'm not here to tell a doctor how to practice. They often like to use other methods of ozone that I've mentioned before because they're far more lucrative. And nobody charges our fees anyway, though I'm not allowed, I'm not supposed to, according to my attorneys, mention fees over the internet, and I'm not gonna. You can call my office at 212-581-0101, 212-581-0101. They'll put you on to me, and then we'll talk, and I can give you fees then that are appropriate to the time you call. Having said all that, so while there is no average, typical, or usual, there actually are numbers for this particular infection that I can give people. It is possible to eliminate this virus. Now listen carefully and don't change the words I say into what you want to hear. It is possible to get rid of this in 20 treatments or less. That's right. I call those ozone miracles. By definition, a miracle should be few and far between, or else it wouldn't be called a miracle. It could take 200 treatments or more. Listen carefully. I didn't stutter. 200 treatments or more. I call that group of people forevers. Fortunately, the forevers are a very small group, and the 20 or less, unfortunately, is a small group, but a bigger group than the forevers. Now, that big range of 20 to 200 treatments is where almost everyone falls. Okay? That's a long, big range, but that's what it generally takes because this is not a very deadly virus. And what we have learned is the deadlier the virus, the easier it is to get rid of it. The less deadly the virus, the harder it is to get rid of it. Because of biochemistry, it's just the physical structure of it makes it harder to penetrate the barriers that prevent the ozone from getting in and inactivating the virus so it can't duplicate itself and eventually it just dies off. And since it's not making babies, you're done with it once and for all. Now, what does once and for all mean? Well, we can eliminate the virus permanently, completely, once and for all. But if I want to say I cured you, then we have to get rid of antibodies. Now, what does that mean? So when you get an infection from a virus, you develop a reaction to it and your body tries to kill it, and it develops what's called antibodies. Now, there are two types that we're concerned about, and only one real type we're concerned about for this. It's the IgM antibodies, immunoglobulin M antibodies, are only high during an outbreak. Once the outbreak is gone, they come down slowly over days to a couple of weeks and back to a normal level. That does not mean the virus is gone. You're just out of that acute and subacute state, chronic again. Then there are the IgGs. The IgGs are supposed to be high, we're taught, for the rest of your life. They're never supposed to go away when you've been infected with a virus, which is what vaccination proves that you've been vaccinated. You develop antibodies with the vaccine, if it's a viral vaccine. And technically, you're never supposed to get rid of them. That's what we're taught in school. Wrong, absolutely wrong. With what they don't know is intravenous ozone therapy, and the direct IV method of intravenous ozone therapy has been known to do what we call seroconversion. We made that term up for ozone because we've been able to seroconvert HIV and Epstein-Barr and CM cytomegalovirus, which are herpes viruses, also HIV positive to negative. So it's possible to eliminate the virus so completely in the body that you don't need to manufacture antibodies for it. Keeping in mind, you can have false positive and false negative tests to any blood test. What we're going to do is go to our last commercial break. When we come back from this, I'm going to tell you a little bit more about how we're going to get rid of it, more about this, and hopefully you'll be able to get your life back again. So stay with us. We'll be right back. So, first of all, things you must do for intravenous ozone therapy of any kind and purpose, and certainly for direct IV. I said it earlier, you got to be well hydrated. Secondly, vitamin C, 5 or 6 doses a day. 500, 1,000, 2,000, 3,000, whatever you can take without upsetting your stomach. But here's the catch. Every 2 hours while you're awake. That's 5 or 6 doses a day, because if you do absorb it into your blood, you're going to use what you need and urinate the rest away. So we have to keep that vitamin C going for a number of reasons. When you come in the office and we do the consultation, or we do I do online consultations now as well, then I can go into more details about these things. So for the sake of you, understand just the basics that I'm giving you here. Then Doctor's Biome. Everybody's got to take Doctor's Biome. Food supplement, or Doctor's Biome medical food, the gut health, very important to boost the T cell system. And because ozone kills all the good boys off in the gut. Now, here's the good news. You can take, if you're on a pharmaceutical or need to take one, God forbid, in an emergency, or if you're taking any nutraceuticals, unless you prefer to spell it natraceutical, vitamins, minerals, herbs, homeopathy, Ayurvedic medicine, Chinese medicine, if you're doing any other therapy that can help your immune system, like chiropractic adjustments or acupuncture, you can be on any special diet you want to be on. It's fine with ozone therapy of any kind, and certainly with direct IV. I promise you, no one has our clinical experience, and if I say you can do it, I don't care what you've read on the internet, I don't care what anyone else says, they're wrong, and I can argue it out with them and be right and win that argument. There's no one can question my clinical experience. Having said all that, you need to do at least 3 or 4 treatments a week intravenously of the direct IV. And now we're going to be adding in intravenous ozonated glycerin, IOG. And we're using a very special medical grade ozonated glycerin. First of all, it's organic, which is something important to me, and not only organic, but ultra pure. We'll have special filters. I mean, I'm very, very careful not to harm anybody. And yet, this may prove to be one of the most powerful ways of killing this virus in the body. So we'll be adding that on, and you'd be able to do that at least once a week. All right. And because we can use very, very little itty bitty needles with both these methods, the direct IV and the IOG, we're using virtually 27 gauge, which is like thinner than an acupuncture needle. We can treat almost virtually anyone. And of course, if people need to get a PICC line, a PICC line, you can look that up on Google. We can use PICC lines for both these methods. They're a gift from God. So virtually 10 out of 10, everybody, 100 out of 100 can have these therapies done to them and for them to eliminate whatever it is we want to treat in you that we can help. Okay. The IOG is going to take about an hour and a half, and you are going to be given a natural blood thinner, a lumbrokinase, or maybe a nattokinase, to thin the blood and make sure there's no clotting that's going to take place. But putting that aside, and that's an hour and a half drip, whereas the direct IV is 2 to 6 minutes. And the direct IV, if we separate the treatments by every 3 hours, you can have more than one a day. Another way to speed the therapy up is to add intravenous glutathione. And I got a big round of applause from the ozone world about, 12 years ago, maybe more, when I came up with why you can use intravenous glutathione with ozone safely, in spite of their belief that you shouldn't. I read the literature differently. People who were born on my planet look on things with a different open mind and read things and understand it, I guess, in a better way. So when you want to use it, I called it a Robin's glute sandwich. You get half your ozone, we disconnect, then we push in the glutathione, which is in a liquid, intravenous liquid form. Then we disconnect, and we give you the other half of your ozone. So we sandwich it together, making sure there's going to be a very powerful kill-off reaction. Why? Well, when ozone enters your blood, it kills all those different things. It does all the things I said before, but it also meets the protein, a protein that your body makes called glutathione, or else you'd be dead. When ozone meets your natural glutathione, there's a chemical reaction that releases your own natural immune products in larger amounts. For those of you that may be scientists out there, reactive oxygen species, peroxides, peroxyls, alkenes, alkanes, superoanions. So it releases, it just creates those in larger amounts, abundant amounts, and lipid oxidation products, particularly alpha and beta interferon, which goes on to destroy viruses. They're using that, for hepatitis C treatments and things like that. So your body naturally now is going to go on and fight this infection for up to 2 hours more. Then we want an hour of what I call waste removal. Just let your body clean out all the debris that we have created from the treatment, and hence the 3-hour delay between doing more than one treatment each day. Now we can enhance each of those treatments by giving you intravenous glutathione, which we have specially made in sterilized syringes. I mean, it's pre-sterilized. I mean, everything we do is done very carefully. So in any case, that can be done with direct IV and get a more powerful benefit from each and every treatment. Remember, 3 or 4 are necessary. More is better in this case. Keep one thing in mind. There's only 2 reactions supposed to have to an ozone therapy of any kind. No reaction at all, or you feel better. In our clinic, any other reaction, it's not for you to figure it out. All my patients have my cell phone number, and they all call me if they need me to tell me, oh, I had this kind of reaction. Does this relate to the ozone? Because it may be related to their medical problem, nothing to do with the ozone. And you can have more than one thing. You don't only have to have HSV-1 or 2 in your body. You can have, we're all loaded with bacteria, virus, fungus, yeast, mold, parasites, toxins, harmful free radicals. Ozone's going to eliminate all of this stuff. So keep in mind that it's going to be doing all this work for you. Can only benefit, but only 2 reactions. No reaction at all, you feel better. Otherwise, if there is some kind of unusual reaction and I relate it to the ozone, when you give me that call, I adjust the medicine. So we keep it comfortable and safe. That's all. Comfortable. You suffered enough, don't have to make you suffer to get better. So we adjust the medicine to make it more comfortable for your body to tolerate all that kill-off that's going to take place. And if patients need to call me every day, they call me every day. Sometimes it's just to answer a question or to boost, give them, deal with a concern they have over it. My patients know that I'm always available anywhere in the world I go. They're always able to reach me. My office and clinic is open 6 days a week. And again, we do online consults. As much as we do in-office consults when I'm there. I'm only in twice a week to the office. I've been in practice 52 years. This is my 52nd year practicing medicine. May not look it, but from the date of this podcast, in 2 days, I'll be 77 years old. That's chronologically. Epidemiologically, I'm probably in my 50s, I hope, though my body is showing wear and tear. That's perfectly normal. So keep this in mind. You can get rid of this horrible, horrible infection permanently, completely, once and for all. If we can get back below 0.9 IgG antibodies, I can legally say I cured you in front of a judge and jury. I have patients that refuse blood testing. They're so embarrassed by this infection, they believe that somehow this information is going to be released on the internet. Or somebody will publish it on page 2 of the New York Times. Listen, this is not rational. This is emotional. And you have to respect people's feelings. And they absolutely feel this is the case. It's not true. Nobody will find out. So I have a protocol around people who refuse blood testing. That's been proven effective and proven to work. I have patients who don't care. They're married, they have significant others. They just want to get rid of this permanently, completely, once and for all. And we have a protocol for them. And then, of course, we have the majority of patients who are interested in blood testing so that we can even truly prove that we cured you. Keep this in mind. No moral and ethical doctor should ever promise and guarantee a result. I don't care if you're successful 10,000 patients in a row for the same exact medical problem. You never know what's going to happen on the next one for some reason. So we don't make those kind of promises and guarantees. However, if you stay with this therapy the way I've outlined it, and you do it as often and prepare yourself and everything the way I've said, I have seen nothing but success. Failures sometimes happen because people stop too soon. They're not preparing themselves correctly for the therapies, so they don't benefit from it tremendously, and then eventually they stop. You have to be a patient for this. Yes, we may get rid of it very fast, but we may not. But if you stay with it, you won't be sorry. You won't be sorry. You'll be, I promise you, you're going to be a happy camper. That's what we have seen, at least anyway. with the possibility of not, but definitely that's what we've seen. Amazing success in the highest percentile of success you can get. Now, once again, phone numbers 888-742-3404. That's for Promolife, Promolife.com, where you can do vaginal and rectal insufflations at home. That's vaginal douches and ozone enemas that can help with this if you can't get help any other way. Not likely going to get rid of it, but certainly can suppress outbreaks. Everybody wants to get Doctor's Biome. Go to doctorsbiome.com. doctorsbiome.com, doctorsbiome.com. And remember to use Howard35. And if you want an additional 10% off, go on auto ship. You can cancel any time, comes with a 100% money back guarantee, and it's free shipping here anywhere in the continental US. Now, once again, if you want to reach me in my office in Manhattan, New York, it's 212-581-0101. That's 212-581-0101. They'll give you my cell number. We'll talk. And if there's somebody I can send you to near where you live, I'll be very happy to do so. So don't hesitate to contact us. That's 212-581-0101. All of you listening to this show, I know how upset, I know how depressed you are, and I know how skeptical you may be that there actually is a way to get rid of it. I don't blame you. You probably have been burnt many, many, many times. Or maybe you haven't, but very possibly have, buying various products advertised over the internet that guarantee or claim it'll get rid of it. I understand. I understand how it's affected you socially. I've had people who finally met after 20 years of looking the love of their life, men and women, and they broke up with them as soon as they found out they had this. I had one man call me up and say, I was looking to get married again, and I finally met two women over the last 3 years that either one would have been perfect for each other. And as soon as they found out that I had herpes, they broke up with me. This man was 72 years old. So who was he dating? Women in their 50s, 60s, and they were still upset about being with somebody that might have it. So I understand how this has affected you. I understand why you want to get rid of it. We're very understanding of this. We keep confidentiality supreme. It reigns supreme in the office. You'll get the rest of the consultation when you do call me and get involved that I couldn't give you over the air here. And we'll be very happy to, once and for all, help you get your life back again from this horrible, horrible infection. Everybody, thank you for listening. Please stay healthy, stay well, and tell all your friends about the podcasts, even if you're not going to tell them why you listened about herpes. So long, everybody. We'll be back again next week here on Functional Medicine with Dr. Robbins. Bye now.